The median nerve originates from the medial and lateral cords of the brachial plexus, carrying fibers from cervical spinal nerves 5 to thoracic spinal nerve 1. It travels down the arm alongside the brachial artery without giving off branches. In the forearm, it passes between the two heads of the pronator teres muscle, then continues between the flexor digitorum superficialis and flexor digitorum profundus muscles. At the wrist, it passes deep to the flexor retinaculum through the carpal tunnel. In the hand, it innervates the thenar muscles, the lateral 2 lumbrical muscles, and provides sensation to the lateral 3.5 fingers. Median nerve injuries can cause carpal tunnel syndrome, leading to numbness, tingling, and weakness in the affected fingers. Proximal injuries, such as pronator teres syndrome or anterior interosseous nerve syndrome, can result in difficulty making a fist or weak thumb movements. Radial nerve originates from the posterior cord of the brachial plexus, carrying fibers from cervical spinal nerves 5 to thoracic spinal nerve 1. It runs along the radial groove of the humerus with the deep brachial artery and supplies the triceps brachii muscle. At the lateral epicondyle of the humerus, it divides into a deep motor branch and a superficial sensory branch. The deep branch, known as the posterior interosseous nerve, passes through the supinator muscle to supply all extensor muscles of the forearm. The superficial branch runs beneath the brachioradialis muscle and provides sensory innervation to the dorsal aspect of the hand, except the fingertips. Radial nerve injuries can lead to wrist drop, seen in Saturday night palsy or humeral shaft fractures. Compression at the supinator muscle can cause posterior interosseous nerve syndrome, resulting in weak finger extension. The ulnar nerve originates from the medial cord of the brachial plexus, carrying fibers from cervical spinal nerve 8 to thoracic spinal nerve 1. It travels down the arm, medial to the brachial artery, and enters the posterior compartment before reaching the elbow. At the elbow, it passes behind the medial epicondyle, where it is vulnerable to injury, commonly called the funny bone. In the forearm, it travels between the flexor digitorum profundus and flexor carpi ulnaris muscles, supplying them. At the wrist, it passes superficial to the flexor retinaculum through Guyon's canal. In the hand, it innervates the hypothenar muscles, the medial 2 lumbrical muscles, the interossei muscles, and provides sensation to the medial 1.5 fingers. Ulnar nerve injuries can cause cubital tunnel syndrome, leading to numbness and weakness in the ring and little fingers. Compression at Guyon's canal can result in ulnar tunnel syndrome, which affects hand grip strength and fine motor control.